All right, World Heart Day message there by the World Heart Federation. Now, today, September 29, is World Heart Day. The heart, like has been said in that message, is the first and last sign of life. That's why we need to talk about our hearts this morning. I get to be joined by the Public Relations Officer of the National Association of Government, Medical, and Dental Practitioners, Dr. Oboho Akaiso. Thank you so very much for joining us this morning, Doctor.
Thank you very much.
All right. The heart. The heart. How important is our heart?
Of course, we are aware that as far as life is concerned, the heart is very, very important. The reason is this, that for the blood that you receive all through your body, the way you pump the blood and the way it is circulated to meet other parts of the body, that is a particular responsibility of the heart. And where the heart is not functioning, you know, of course, what that means.
Okay.
It means every other part of the body cease to function.
Okay, like you said, I just love the caption, the first and last sign of life. Can you expatiate some more on that?
Yes, like I said earlier, that the heart, the blood is a man. That's the first part of life.
Okay.
And then this blood must be circulated somewhere and then be distributed to every part of the body. That's why as we go in the course of this discourse, we will see some of the problems that the cessation of the pumping action of the heart would cause to the part of the body. And so the blood has to be pumped through the heart and then circulate through some veins in the body. Some goes to the brain, some goes back to the abdomen, some goes back to the the upper limbs, the lower limbs, and that is how the function goes. So it starts and ends from at the level of the heart. So where that heart is not functioning, it means the pumping of the blood and circulation. No, these are two major functions. It pumps and also circulates to other parts of the body.
Okay.
So it's critical.
Okay, the heart pumps and also circulates.
Yes.
What could cause the heart to stop pumping or circulating?
Yes, that's why I think that's why we are here today.
That's right.
And we talk of cardiovascular diseases of the heart. That is it is a group of disorders of the heart that connects the heart itself and the vessels. That's the blood vessels within the heart. And so that's what we call the cardiovascular disease. And so where those cardiovascular disease comes up, it stops the circulation, it stops the pumping of blood to other parts of the body. And then we have had that severally. We could have what we call heart failure as a result. We could have what we have a cerebrovascular disease, which we normally call stroke. We can also have sometimes hypertension comes up. You see hypertension, there's what we call a coronary artery disease also that comes up as a result of this general name called the cardiovascular disease. So it's a major problem that could affect the heart if there is problem. And there are issues surrounding, probably when we get there, we'll also talk on what will eventually make the cardiovascular disease to come up, and why the hypertension, as it were, the cerebrovascular disease and the rest of the heart disease will come up.
Okay, so let's go ahead and talk about that. What causes these cardiovascular diseases?
Yes, it's a practical thing. In the course of discussion also, we'll get to know some certain interventions that we give a name to. But basically, unhealthy diet is one of the major causes of the cardiovascular disease. Also, we talk of the use of tobacco, like cigarettes. People take it just the way they like it. There is no control over it. You can also talk about the fat intake of some people, the diet itself, physical inactivity. Some people don't even have time for activity. Physical activities like exercises and all that. Some people are not even sleeping, and then you see that at the end of the day, all those things come up and attack the heart, and then we have what we call cardiovascular diseases that will, in the long run, result in hypertension, result in cerebrovascular disease, result in heart attack, majorly heart attack.
So, Cerebral. Talk to us about cerebrovascular diseases.
Cerebro,
Which are they?
as the name implies, cerebro, it's the cerebrum up there,
Okay.
your brain,
Okay.
and then the vascular is the vessels. And so, since the heart's duty is to pump this blood through those vessels back to the cerebrum, so there's a connect between the heart and the brain. And so, where that part of the heart is not receiving the necessary blood from that part of the brain is not receiving the necessary blood from the heart, so that area, the function around that area is impeded, and that's what we call stroke.
Okay.
You see, so that part
Okay.
of the brain becomes dead. It's not being supplied by blood that is meant to come from the heart. The heart is diseased, and as a result, it affects the brain.
Okay. What about hypertension?
Yes,
What causes-
hypertension also, like when I was walking into this place, and you see maybe one or two persons were at the junction at the roadside.
Okay.
And then you want to come in, and then you now see people lining up in their numbers, and so I'm trying to struggle to enter. In trying to do that, you know what will happen? I'm trying to generate pressure around that, and that pressure coming in is what we call high blood pressure. So you generate that pressure within the vascular wall. If you check the vascular wall, it's a small it's a vein or the artery. So you see some because of our lifestyle, like we talked about, the diet we are taking, sometimes we are not exercising, and now you see some plaques lining up along the vascular walls. So when the blood flow were supposed to come in and have their free movement, they are not having it, so they start building up that pressure, and that's what results to what we call hypertension.
Okay.
And so it's also a problem that we have seen arising from the inability of people to take simple instruction in respect of having a healthy heart.
Okay. And you talked about those instructions, those lifestyle we could adhere to.
Yeah.
Now we have so much of this. Every you get into the hospital, high blood, it's on the rise. Why so these days?
Yeah, like I talked about the diet. Sometimes people are not checking the cholesterol level. There's what we call the lipids or
Okay.
the fat content of the food. I know sometimes we're supposed to be taking probably fruits and maybe vegetable, but we are not doing so. We are now because of globalization. We are the superior culture from the other part of the world is now coming into our own setting, such that people now tend to be taking all those junk food, the foods that contain fats and lipids and all that, and salt, most basically salt. You see people, the rate at which people take salt, and so these things have effects on the blood vessels. And then before you know, it's resulted to, especially in a situation where settings are not in place to check, to counsel, to get where we can have those drugs and give to them, and so it results to all these things. That's why we are here. I'm very, very sure by the virtue of the World Heart Day today, a message will be sent to the entire state.
Okay, and right, that's right. We are also here to ensure the message to the world. All right, let's talk about age. The age factor. Does the age factor come to play these days? As we see even young people, children, toddlers, come up with heart diseases.
Yeah, age is not in consideration, as it were, today.
Okay.
Of course, a number of persons from data, the number of persons who died of heart diseases are people of below 50, 60, sometimes between 50 to 45, 40 something. Of course, we are in active practice in the hospital, so we see these things. We see that a child of 28 years come up with like hypertension, sometimes congenital heart disease. Those ones are natural things that come with birth. So we see those ones, but the one that marvels some of us is that you see a child of 25, 28 and they are coming up with hypertension. Then you ask a question, what is the problem? You check down, you see that lifestyles. So age is not really a matter that should be used to say, oh, if I am 10 years or 20 years, I should not be living a healthy heart living. Because I don't have any problem about it. No, there is a chain that is now going back to the younger generation.
Okay.
So,
What about genetic
yes,
factors?
that's why I talked about congenital heart disease.
Okay.
The congenital heart disease, those one has to do with the genetics. So it comes from the parents, from the mother or the father, and translate to the child. That's why some of them comes directly with it. So genetics also play part in the heart disease we have. But the ability to detect them early enough, the ability to see how we can manage them, can give us another long life to live on earth.
Okay, early detection matters.
Yes.
All right, so it can be hereditary factors also comes to
Yes,
play.
hereditary.
Okay.
Yes, it's
Okay.
hereditary. Genetics, both genetics and hereditary comes together to give some of those child that comes up, and then you have some rheumatic heart disease. Those ones has to do exactly with hereditary and genetics.
Okay.
So we have them.
Okay.
They also exist.
All right, you talked about you mentioned some of the CVDs, that's the cardiovascular diseases, and stroke is one of them, and we get to hear story cases of stroke um, within our society. Can you expatiate some more about stroke and how it occurs?
Yes, that's what I earlier mentioned as cerebrovascular disease.
Okay, yeah.
It is also called stroke. And so cerebrovascular disease has to do with the brain. And in the brain, there are so many centers within the brain that controls the hand, the legs, and all parts of the body.
So, and stroke is what we call akpaubeng in our. Okay,
In
that's
our
right. I
local,
needed you to talk about it
yes,
again.
akpaubeng.
Yeah.
And so so when a blood has to be pumped from the heart, and then there is a connection that goes after pumping the blood, it goes straight to the cerebrum. And in that part of the cerebrum, the body is supposed to the vessels are supposed to be in their good condition to be able to connect and supply that part of it. That's why sometimes you have some people have it on the left side, some people have it on the right side. It depending on the area that is not functioning, the area that is not supplying the necessary blood from the heart to the brain. Okay. So it comes up with a stroke at that level.
Okay, all right. Let's talk about you talked about unhealthy diets. What are the healthy diets we should consume, and what lifestyle should we maintain for our heart to function properly?
Yeah, one of the things people are not doing is the lifestyle of fruits. We are just looking at fruit as a mere thing that shouldn't come in, and vegetables, and the rate at which we eat all the junk foods now. We see them everywhere. Sometimes you go, they call it corn beef and all those stuff. That's what people are now appreciating more. Of course, it's an imposition from the superior culture globally, and that's what we are now seeing. So people are now going into that. But if people can now diversify back again to fruits, to vegetables, reduce their level of salt consumption, also alcohol. A lot of people, harmful intake of alcohol. People should also regulate it. People can also, in tobacco use, people should also go away from tobacco usage. And those are the areas we are lacking. And so once we go back to those things and put those things in check, you see that we'll be able to avoid so many of the cardiovascular diseases around.
Okay. Now, in all of these, what interventions are available when we have malfunctioning of the heart in any?
There's what we call seed intervention. Seed intervention. Seed has to do with the sleep, the emotion, the exercises, and the diets you take.
Sleep,
sleep, emotions, exercise, and then the diets.
Okay.
So we call it seed intervention. Seed intervention has to do with managing, because sleep plays a very major role in bringing down the level of damages done to the heart. People are not sleeping. You see people we hang out till maybe taking alcohol, tobacco, till maybe late in the night, and people start going back, but in the next morning they'll start rushing out again, and so they are not taking that into consideration. So we should do it. It's an intervention. It's something that should be done. And
but
then
what should be the duration for sleep for people?
Of course, the duration between the hour of 8 o'clock or 9 o'clock basically p.m.
Okay.
till 5 a.m. in the morning.
Wow.
That should be, yes. You need enough rest. The body need that rest to be able to settle everything, all the pressure, all the whatever thing that has happened in the course of the day should settle down, and then give you a refreshment for the next day. But people are not making use of that. Also the emotions, we are not controlling the emotions. Sometimes people we run out of our emotions. Probably we get angered by a little slightest thing that shouldn't come, and we become emotional. Probably we are poverty level and so many other things. So people should put that into check. Then another one we talk about, that seed and exercises. Very, very physical exercises, very, very important. When you exercise your body, you are simply breaking down the fat accumulation within the vessels. There's what we call atherosclerosis. That's when those plaques line up around the vessels. And so by the time you exercise yourself, you are simply breaking those things out and then allowing the vessels to be free for blood flow to get through. And of course, the diet is most basically salt intake. Salt intake. That's one of the major implications of cardiovascular disease, especially the hypertension. So people should take precaution, and beyond that, government policy has to be in place too. Very, very important. Now, government policy, we have primary health facilities across the state, but the question is, are they well equipped with modern technologies? Do we also have some counselors who are there to intervene? Do we also have some drugs that as soon as you are diagnosed of a particular disease, the drugs are given to you, you are counseled? Do we have all those things? So all those things should be in check. It's one of the major interventions that can be done. Government have been doing it. And the another problem is, are people going to adhere to some of this instruction? Because it should be a win-win thing. If government is doing from the other side, then there must be people who are ready to adhere to it. That is the way out. So I'm talking to Akwa people to ensure that not only will government make provisions, bring up policies and bring up facilities and drugs. Sometimes drugs are in the facilities and get expired because people are not appreciating it. People are not making use of it. People are not even going to the hospital. It happens to me also in my place where I am as a medical doctor. And you are giving prescription to someone, and someone prefers to go the other way around, and so it becomes a problem. So people should take precaution and should adhere to every medical prescription, every medical direction should be followed strictly. The hospitals are all there, so we should make use of it.
Now, are there some basics that family members could do to help someone who is in a crisis, any heart crisis?
Yes.
Are there any basics? What can they do immediately?
Yes, that is why the family, it's especially at the level of the primary health level. You see, many people are involved. Some persons are social workers that interact with families. Some families also must be able to listen to what is happening around them. I just had a case. I'm managing some cases, COVID-19 cases, and I discovered that even when the younger girl was now suggesting that they should go for COVID-19 test, that they've been treating malaria over and again and are not having result, they were saying no, it's not possible until the girl has to live on her own and move to the isolation center and get tested, and she was positive. And that was how the entire household was able to be checked, and they found out that everybody in the house were positive for COVID-19.
So the heart and COVID-19, what relationship is there?
I mean, of course, when we talk of COVID-19, do you know the symptoms? There is a chest pain. There is it has to do with respiratory system. Remember, the respiratory system, between the heart and the lungs, they are two things together. So whatever affects this one must surely affect the other one. So they have this connection together. If there is any fluid overload at the level of the lungs, which can result to maybe cough and all those respiratory symptoms, of course it will affect the function of the heart. So the heart cannot even pump again. It will relax. And so that's why you have respiratory symptoms and all those stuff in COVID-19, which are completely related. Remember this, there are if you check the heart, once you go behind the heart, there is another vessel that connects from the heart to the lungs.
Okay.
So they are, of course, every part of the body are connected. So one thing affecting this one would affect the other one.
Okay. Now, are people who are unfortunate to have the CDVs, any of them, are they more at risk when it comes to COVID-19?
Yes, of course, they are. That's what we call a comorbidity. So when we are examining patient who is coming up for COVID-19 or who is already positive for COVID-19, of course we need to check: do you have hypertension? Do you have diabetes? Do you have any other congenital heart disease, or you have any maybe rheumatic heart disease? We want to check because it have direct effects, and those are some of the person we've been losing to as a result of COVID-19, not necessarily the people who have a clear slate of their hearts.
Okay. Now for this year 2021, the theme is use the heart to connect. Yes. Talk to us about the significance of this theme.
Yeah. Before I talk about that, permit me to just rush through a little bit of history about it. In 2000, specifically on the 24th of September 2000, the World Heart Foundation or Federation came up with a notion to be celebrating a World Heart Day in collaboration with the WHO, the World Health Organization. And the idea was birthed by the then president of that group called Antonio Luna. Antonio Luna said, "Oh, we need to be celebrating the World Heart Day. The significance is this: so many persons actually dying of a known, we call it a non-communicable disease, like the heart disease. Many people are dying in silence. Over 17.9 million people in 2015 died of it. As we speak, globally, as we speak, 18.6 million persons have been dying annually globally of this COVID. So these people now said, oh, we need to do something. We need to create awareness on how to have a very healthy heart. We need to also tell the people the risks they are having, the damages they are causing to their heart. We need to educate them. They need to know it. So the man came up. But in 2000, so that it has always been on the last Sunday of September, from that 2000 to 2011. So from 2012, some world leaders who are pathetic about the health of our citizens now came out and say, no, we need to have a specific day. That's how we came up to 29th of September of every year to celebrate. The significance is awareness. The significance is to educate. You need to let the people know that there are risks that are involved in having the heart attack. And one of those things is what we just mentioned: the lifestyle, the diet we use, the tobacco use, the harmful use of alcohol, and the rest of the things. So the awareness is a major thing that these people came up with. The idea is they came up with, let us tell the people the risks involved in their hearts. Let's see how we can educate them. So those are the significance.
Okay.
And that's what we are equally doing right now. So we now use what we call a digital health. Remember, we have gone global. You know, through communications, through commerce, through transportations, we can send the information across to the people and tell the people, look, you need to live. For you to live long, you need to protect your heart. You need to be aware that your heart is the number one thing that you have. If you subtract your heart from you, of course, there is no life.
Okay. Now, still as part of this year's theme, I read somewhere that there's need to harness the power of digital health to improve awareness, prevention, and management of CVDs globally. Quickly summarize that.
Yes, like we just said, you know, it's what we are trying to do now. That like when I said that government policy includes setting up primary health facilities across, where people can now easily be diagnosed, people can be identified with with heart diseases
Okay.
and be referred to this place. Not just that, there should be in the area of management, there should be those drugs should be available, not just be having those facilities on ground. The drugs are modern facilities available
Okay.
for the management of these cases.
Okay.
Who are the people to identify them immediately? Like you said, the family members could see, oh, or the social workers around who have been having this check on the people. It's okay. This person's likely having a heart disease. You refer to this point, and then there's management. So that's what this day is talking about, and that management at that level, and also counselors, very important.
Okay.
Counselors, those counselors can be found at that level of the facilities. That's the primary health, because that's where it is very close to the people. People, for someone to start moving to a general hospital is very, very difficult, but the health center within your facility, your vicinity, is the next place to. So those places should be equipped with the technologies, with the manpower, and also the medications and counselors.
Okay. Okay, in case you're just joining us, today, September 29, is World Heart Day, and I'm being joined by the Public Relations Officer, National Association of Government, Medical and Dental Practitioners, Dr. Oboho Akaiso. Now, to wrap up this session, Doctor, for most diseases, you keep hearing early detection is key. Can you talk to Akwa Ibom people about that, and then, in summary, why we need to take care of our hearts?
Very important. Thank you very much. Early detection is, of course, one aspect of the way you can live a very good and healthy life. Sometimes it starts from a mere pain, and some people ignore pains. They say, it's just an ordinary pains now, and it could start from headache. So someone who has hypertension, I've seen someone, I've been having headache over and again. People are not taking notes of that, and so as Akwa Ibom people, we need to see all those small signs. Are you having difficulty in breathing per time? You need to report to the appropriate quarter immediately. Are you having this chest pain? Report it, because there are so many causes of the chest pain you are seeing. There are so many causes of the headache you are seeing. It may not be a malaria. Some people sometimes they say, because I have headache, it's malaria. No, but hypertension presents that way too. Are you having blurred vision? Reports. What are any symptoms you find within yourself? Report immediately, because usual language, we say early to bed is early to wake. So when you detect it early, probably we have a way to help you out. So stop keeping it to yourself. Stop telling yourself it's just malaria. It may be beyond malaria. Just go and be diagnosed. Let someone who knows better tell you exactly what it means. Let there be that interpretation. I think that's the essence of celebrating this day. And so, my Akwa Ibom people, I want to please make sure you whatever symptoms you have within you, whether it is headache, whether it is chest pain, whether it is a respiratory symptom, whether you're having numbness of both hands and legs, please report to health workers immediately. That's the only way you can save your life from cardiovascular diseases.
All right. Early detection is key, and like they say, the heart is the first and last sign of life. That's a way of commemorating the 2021 World Heart Day. Now we have more for you on Center Point here. By the way, thank you so very much for having found time to be on our program to enlighten and inform Akwa Ibom people about the heart. Thank you so very much, Doctor.
Thank you.
All right. It's still Center Point AM45. We do have more for you on the program on the heels of this time out. We'll be bringing you a message on hypertension. We will be talking about the state of the polity, and in particular, NDDC, even deep sea port, and the matters arising. Do stay with us on Center Point.